Today we are going to see the humerus bone. First you see how to determine the side of the humerus. Then we discuss about the what are the different parts and features and its clinical importance. All these things about the humerus. Okay, first you see how to determine the side of the humerus. Right? This is the humerus. It belongs to which side? This is belongs to the left side humerus. How to determine the side here? First point, this is the head. Head must be directed medially upwards and backwards. Head must be directed medially upwards and backwards. This is the first point. Next you see this is the lower end, expanded lower end. And lower end it consists of three. Anteriorly there are two fossa and posteriorly there is a one fossa, big fossa, and this big fossa is called olecranon fossa. This big fossa must be posterior. Big fossa must be posterior. This is the one important point. And next head is the most important structure. It must be directed upwards, backwards and medially. Next you see here just lateral to this head, here there is a one bony prominence. This is called lesser tubercle, and then here this is the another tubercle. This is the greater tubercle. In between these two, here there is a groove. This groove is called intertubercular sulcus, or this is also called bicipital groove. It must be anterior. It must be anterior. So with the help of these features, you can determine the side of the humerus, right? Next, coming to the, so with the help of these points, so this is the head is directed medially upwards and backwards, and the greater tubercle is in front, and this fossa, big olecranon fossa, is the posterior surface. So if you keep both this bone like this, this bone it belongs to left side. Okay, that's it. How to determine the side of the humerus. Next, coming to the features of the humerus. First we see about the this humerus. It is a long bone. It consists of three parts, that is the upper end, shaft, lower end, right, like other long bones. Next, what are the features in the upper end? First you see, first one is the, this is the head. Okay, this is the 1/3 of the sphere. It articulates with the glenoid cavity of the scapula. Then it takes part in the formation of hip joint or glenohumeral joint. Okay, this is the head. Next, immediately after head, here there is a margin-like structure. This is called anatomical neck of the humerus. Anatomical neck of the humerus. Next, just posterior lateral to this anatomical neck of the humerus, you will get two prominences, bony prominences. That is, this one is called, a smaller one is called lesser tubercle, and big one is called greater tubercle. This lateral big one is called greater tubercle. Anterior smaller bony prominence, this is called lesser tubercle. Next, in between these two tubercles, here you will get another groove. This is called bicipital groove or intertubercular sulcus. Intertubercular sulcus. Here, this greater tubercle, this one, this is the very important structure because it forms the lateral boundary of the shoulder, and then it provides attachment to three important muscles. That is, they are called sit muscles from above downwards. This is the supraspinatus muscle gets inserted here. Then next infraspinatus, then teres minor muscle. Teres minor. These are the three muscles. They get inserted to this greater tubercle, and lesser tubercle also provides attachment to an insertion to the one important muscle that is called subscapularis muscle. Subscapularis muscle. Okay, so these four muscles together they form a specialized structure around the shoulder joint. This is called rotator cuff. This is called rotator cuff. These are all four are called rotator cuff muscles. Next, if you see here, this is the lesser tubercle, this is the greater tubercle. In between these two, there is a groove, and this is called intertubercular sulcus or bicipital groove. Why it is called bicipital groove? Because the long head of the biceps tendon, it passes through this groove. That is why it is called bicipital groove. In living conditions, this bicipital groove, it is built by a ligament that is called transverse humeral ligament. Transverse humeral ligament, like this. Transverse humeral ligament, and this deep to this ligament only, this biceps tendon passes like this. Okay, this is the transverse humeral ligament, right? And next important point related to the upper end is just below the this head of the humerus, in this narrow area. In this area, this narrow area, we call it as surgical neck of the humerus. Surgical neck of the humerus. The surgical neck of the humerus, it is clinically very important because this is the most common site for the fracture of the humerus. And if there is a fracture of the surgical neck of the humerus, it leads to damage to an important nerve here that is called axillary nerve. Axillary nerve gets damaged if there is a fracture of the surgical neck of the humerus. That is why the surgical neck of the humerus, it is clinically, it is very, very important. Once there is a damage to this axillary nerve, and this nerve, it supplies to the deltoid muscle and the teres minor muscles, these muscles gets paralyzed, then the person is unable to abduct the shoulder joint. Okay, that is why this surgical neck of the humerus, it is clinically, it is very, very important. Okay, there is in the early stages of bone development, there is another neck just 1.5 centimeters above the surgical neck of the humerus. In this level, there is another neck that is called morphological neck. But in developed bone, there is no morphological neck. We are unable to find out. That is another neck. Okay, these are all the important points related to the upper end of the humerus. Then, if you see the here, this is the bicipital groove. This intertubercular sulcus, it continues down as the bicipital groove, and it is having three parts, three attachments here. That is this is called medial lip of the bicipital groove, and this is called lateral lip of the bicipital groove, and this is called sulcus. Okay, this is the sulcus. Here, the medial lip of the bicipital groove, it provides insertion to the one important muscle that is called teres major muscle, and lateral lip of the bicipital groove, it provides insertion to the another important muscle that is the pectoralis major muscle, and in between these two, here this groove, it provides insertion to the another muscle that is called latissimus dorsi muscle. So we call it normally, we call it as a lady between two major, that is one major is the teres major, another is the pectoralis major. The lady is between these two majors, that is the latissimus dorsi muscle. So these are all the important points which are related to the upper end of the humerus. Then you come to the shaft. Shaft of the humerus, it consists of three borders and three surfaces. Then if you see this is the anterior border. Okay, then this is the lateral border, this is the medial border, right? And surfaces are antero-medial surface, antero-lateral surface, and posterior surface. Posterior surface. But these surfaces are not well defined. Here, if you see the anterior border, this is the anterior border. The anterior border, between the anterior border and lateral border, here there is a anterolateral surface. At this level, it provides insertion to important muscle that is called deltoid muscle. That this is called deltoid tuberosity. Deltoid tuberosity of the humerus muscle, humerus bone. This is the one important point. Next, coming to the medial border. This in the medial border, almost in the middle of the shaft of the humerus, you will get a muscle insertion in this area. This is called coracobrachialis muscle. Coracobrachialis muscle gets inserted here. So, if you observe here, upper part of the humerus, upper end of the upper half of the humerus, it is monopolarized by muscles or insertions of the muscles. Here you see this is the site for the insertion of the subscapularis muscle, and here this is the sit muscles, that is the supinator, supraspinatus, infraspinatus, and teres minor muscle, and here this is the for the teres major muscle, here latissimus dorsi muscle, here pectoralis major muscle, and here there is a deltoid muscle, and here this is the muscle that is coracobrachialis muscle. All these muscle gets inserted to the upper half of the humerus. That is why this upper half of the humerus, it is monopolarized by insertions of the muscles. Okay, that is an important point. Next, coming to the lower half part of this humerus, if you take the section of this shaft of the humerus, you will get a triangular appearance in the lower part. but in the upper part it is almost cylindrical in shape. Okay. Next, another important point related to the shaft, you will get here there is one important groove, or this is called spiral groove. Spiral groove, or this is also called radial groove, because this radial nerve passes through this like this in the spiral fashion. That is why it is called spiral groove or radial groove in the posterior surface, and it also cuts the lateral border. Okay, this is called spiral groove or radial groove. Through this only the radial nerve passes. Then that is why it is also called radial groove. Okay, here also it is clinically it is very important because there is a chances for damage to this radial nerve once there is a fracture of this shaft of the humerus. Okay, that is an important point. Then it produces extensor muscle paralysis, or sometimes it may be just compressed the radial nerve in this spiral groove or radial groove. Then it leads to a condition that is called Saturday night palsy. Saturday night palsy. In the Western countries, they used to take alcohol, more alcohol, especially during Saturday night, because Sunday is holiday. So then if they sit on the chair and then they become unconscious while drunken state, then there is a chances for compression over this radial nerve. Then it leads to Saturday night palsy. Okay, this is the another important point. These are the two nerves. Till now we discussed two nerves. One is the axillary nerve. It comes in contact with the surgical neck of the humerus, and radial nerve it comes in contact with the spiral groove or radial groove of the humerus. Then you come to the lower end. In the lower end of the humerus, we'll get some structures. That is, you see, this is where the articular surface. This articular area you call it as capitulum. This is called capitulum. Then this pulley-like structure, this is called trochlea. Okay, these two capitulum articulates with the head of the radius. Then it takes part in the formation of this joint, elbow joint. Okay, it articulates like this. Okay, this is the head of the radius and capitulum. Then this pulley-like structure, this is the trochlea. This trochlea articulates with the ulna. Then it also takes part in the formation of elbow joint. Okay, so these are the two structures. They articulate with the two muscle, bones. Then it takes part in the formation of elbow joint. Another important thing, apart from this trochlea and capitulum, you can also observe here there are in the anterior part of the lower end there are two fossa. This is the one fossa. This is another fossa. This lateral fossa, it is meant for the accommodation of the head of the this radius. That is why it is called radial fossa. And medial fossa, it is called that is a coronoid fossa. Coronoid fossa, because this coronoid fossa it provides accommodation to the coronoid process of the ulna during a full flexion like this full flexion. And if you see the radial fossa, the radius it gets flexed like this, it gets accommodated in the radial fossa. These are the two most important fossa in the anterior part of the lower end of the humerus. Then if you see the posterior part, here you will get a big fossa in the posterior part. Okay, posterior surface of the lower end of the humerus, there is a big fossa. This fossa is called olecranon fossa, because this olecranon process of the ulna, it is gets accommodated here. That is why it is called olecranon fossa, and it gets accommodated in the full extension of the elbow joint. Full extension of the elbow joint. Okay, these are the three fossa in the lower end of the humerus. You must keep in mind. Here there are two articular surfaces. One is the capitulum, this trochlea, and this is a coronoid fossa. This is the radial fossa. In the posterior part, there is another big fossa that is called olecranon fossa. So these are the three fossa and two articular processes. Next, come to these bony prominences on the lateral side and medial side. This is called medial condyle. This is called lateral condyle. Okay, these two lateral and medial condyles they provide origin to the muscles of the forearm. Okay, suppose if you take medial condyle, provides a common origin for the flexor group of muscles of the forearm. Then lateral condyle provides an extensor group of muscles common origin. Okay, so these are the two most important point. Here, next another important thing. Sometimes there may be chances for this fracture of the humerus in the lower above this condyles. That is called supracondylar fracture. Supracondylar fracture. Over this supracondylar area, there is a brachial artery and median nerve passes like this. Brachial artery and median nerve passes. Whenever there is a damage to this one, then it leads to damage to these structures. Then it may produce its own manifestations, especially there is a brachial artery constriction. It may produce a lack of blood supply to the distal part of the limb. Okay, that is the other important point. And next, if you see the medial condyle, just posterior to this one, here you will get a groove, small groove here, and this is the area. It provides passage for the ulnar nerve. Okay, and if there is a fracture of this medial condyle, it may lead to damage to the ulnar nerve. Then it produces its own manifestations, especially the ulnar nerve. It supplies to the flexor group of muscles of the forearm. Then it also supplies to the most of the intrinsic muscles of the palm. Okay, that is an important point you're supposed to remember. And this is not only this ulnar nerve. It is most commonly felt now below the medial condyle. You can feel just below the skin. You can feel cord-like structure, and it is more prominent, especially in people who are suffering with leprosy or Hansen's disease. Hansen's disease or leprosy, it is more prominent. That is also one of the most important clinical point which is related to this medial condyle of the humerus. Right? These are so. If you see here, there are three important nerves that are coming in contact with the humerus at three different parts. Here, this is the area we'll see. This area, it comes in contact with the axillary nerve. Okay, then it supplies to the deltoid muscle and teres minor muscle. If it gets paralyzed or damaged, it may lead to the loss of extension, abduction of the shoulder joint. Okay, that is an important point. Next, if you see the spiral groove or radial groove, okay, in the middle of the shaft, and especially in the posterior surface and lateral border, here you will get the radial nerve comes in direct contact with this area. If there is a damage to or fracture of this middle of the shaft of the humerus, it leads to damage to this radial nerve, or this compression over this area. It may produce a temporary paralysis of the extensor muscles of the forearm. Next, another nerve is the ulnar nerve. It is in close contact with the posterior surface of the medial condyle of the humerus. If there is a fracture of this one, it may lead to the compression or damage to the ulnar nerve. And here, if there is a supracondylar fracture in this area, it may produce the damage damage to this brachial artery and median nerve. Then it will produce its own clinical manifestations. So, with the help of this, we can study about the humerus and its some important points, clinical points and identification points. That is about today's discussion about the humerus. Thank you for watching. Follow for more informative videos. Thank you very much.